Hi, and welcome to Teaching Tip Tuesday, brought to you by the Center for Inclusive Teaching and Learning at UWSP. If you're a political junkie like me, with thoughts of the last two elections in mind, the prospect of the November presidential election may have you ready to run for the hills or make a break for Canada. But if you're sticking around, it's time to take stock. If the 2016 and 2020 elections have taught us anything, it would be that as members of the university community, we need to prepare before the presidential election because there's really no telling exactly what's going to happen. That's why we here at CITL have organized a 6-part series of teaching tips to help you consider how to address election-related issues in your course. We're delivering these well in advance of the election itself to give you time to consider them and to reach out to us if you'd like some support. In our first installment, I'd like to discuss how elections are related to mental health and give you some ideas of how to provide support for your students and for yourself in these tumultuous times. A lot of folks experienced negative mental health consequences as a result of the 2016 presidential election. In a study of almost 500,000 adults in the Behavioral Risk Factor Surveillance System from May 2016 through May 2017, over half reported before the election that it was a source of significant stress. After the election, in January 2017, 49% reported that the outcome of the election was stressful. Yan and colleagues found that self-reported days of poor mental health increased in states that went for Clinton, so those who lost the election. Mean poor mental health days increased from 3.35 days per month in October to 3.85 days in December. This means that in those states combined, there were 54.6 million more days of poor mental health in December than in October of 2016. In contrast, patients in states that went to Trump showed no significant change. The 2020 election was a bit easier on campuses than the 2016 election. Because it was during the pandemic closure, we weren't face-to-face with the emotionally distraught students that you may recall from 2016. But Americans as a whole showed signs of mental health impairment. In one study by Fraser et al., authors estimated a rate of PTSD in adult Americans of 12.5% in the weeks after the election, up from the average annual prevalence of 3.5%. PTSD indicates severe effects, not the more casual poor mental health days of the Yan study. The effect was not correlated with political party, though interestingly, the lowest rates were among self-described independent voters. Correlates that were significant were how much affective polarization people showed, that is, how negatively they viewed the other political party, perhaps explaining why independents had such low scores, how old they were, younger folks showed more PTSD, and having greater negative emotionality scores, that is, if your personality wasn't positive and bubbly to begin with. Keep in mind that these results do not include responses from January 6th, which I'm sure would have made them more complex. So what does this mean for us as we approach this fall's presidential election? I'd say nothing particularly good. Many of the same stressors are in place for this election that we saw in the last two. Divisive rhetoric, polarization, large differences in how knowledgeable people are about the parties, candidates, and platforms, and big differences in the stakes of the election for different demographic groups. So it's likely that the election will produce effects on the mental health of students and colleagues. You should plan your strategy for dealing with these effects now. Here are some tips. First, practice self-care. You're no good to anyone if your house isn't in order. Keep your boundaries. If you aren't in the headspace to discuss something potentially volatile, acknowledge the interest or concern of others, but put a pin in it and engage when you're ready. Give yourself a break from news or upsetting discussions if you need it. Take a walk, go get a coffee or soda, or find a dog to pet. Identify sources of emotional support, family and friends, for venting. Don't bottle it up, because you won't have enough emotional buffer left to be effective in your job. Be aware of other mental health options if you need them. The HR website at our university has some good links, including the Well Wisconsin program, which offers helpful videos and calls from coaches and counselors. The Universities of Wisconsin Employee Assistance Program offers resources for coping with stress at work. And don't forget to exercise, because you probably need to blow off steam and get some endorphins pumping. Second, work toward building a positive class climate and community among the students. This is important for academic success in good times, but having a supportive network of peers is critical in stressful times. You can collaborate with students to develop policies or behavioral norms centered on respectful and civil discourse in the classroom. Co-creation of rules of engagement surrounding the election will give students ownership of those rules and make them more sensitive and respectful in abiding by them. Be sure to include assuming goodwill and exercising shared responsibility for the quality of discussions in the class. Provide opportunities for students to interact and discuss less charged topics to get to know one another. Part of the problem with affective polarization and thinking negatively about people in the other party stems from lack of knowing one another as people. Allowing students to develop relationships in a diverse setting can only help. Third, be aware of how different identity groups may be perceiving election rhetoric and potential policies differently. Almost none of the major policy issues in this election affect everybody equally. People's experiences, identities, and values are intimately tied to their political perspectives. Consider that men, women, Muslims, Christians, Black Americans, Latino Americans, immigrants, people with disabilities, and LGBTQIA+ students may each feel targeted by different policies, candidates, or parties. Be sensitive to how sustained feelings of anxiety and fear can affect students' engagement. It's hard to concentrate on a lecture about photosynthesis when you're worried about how the election will affect your life and who you can marry. Have a toolkit of self-care suggestions for students who seem stressed. If possible, include the voices and perspectives of targeted groups in your course materials and activities, both to enhance the diversity reflected in your course content, but also to engage students in thoughtful contemplation of some of these profound differences in the way that people view issues because of their identities. Finally, be aware of the mental health support systems that are offered on our campus for students. Fourth, plan for flexibility and leniency. If this election goes poorly, or if it's contested, your students may feel a huge threat to their security. They may be tapped out for a bit. Consider flexible deadlines. These may be especially necessary in the days before and just after the election. You should never penalize a student's grade because they're emotionally compromised. It's cruel to pour salt in a wound. Lastly, you can help students develop some resilience by working with them to set reasonable goals and timeframes for any work they miss. Supporting the mental health of all during a tense election season will make your course run more smoothly and help students develop coping skills. Be sure to tune in next week when I'll talk about how to approach embedding election-related content and activities in your course. And that's this week's teaching tip, brought to you by the Center for Inclusive Teaching and Learning at UWSP. At CITL, we offer support for course design, learning activities, assessment, and pedagogy. Visit our website to schedule a consultation today.